Hello, everyone, and welcome back to the So Happy Together podcast, the podcast where we unmask modern dating and relationships through both lived experience and evidence based insight. My name's Ellie. I'm a licensed master social worker. For anyone who is new to the podcast, if you've been following recently, we are in the Therapy for Love series. And if you have been following, you already know this. Therapy isn't just about talking, it's structured, it's intentional, and it's meant to change how you show up in your relationships. In the first episode of this series, we broke down 3 core approaches: insight based therapy, body based therapy, and skills based therapy. And in the second episode, we went deeper into body based therapy, specifically somatic therapy, with our expert and licensed marriage and family therapist, Chloe Bean. And we talked about how your nervous system shows up in real time and how recognizing that activation can shift the way you respond, not just emotionally, but physically too. And today we're getting into what most people are missing: how you actually change. Because here's the truth: a lot of people are aware of their patterns, but they're still repeating them. They can name them, they can explain them, they can even predict what's going to happen, but they're still engaging in those behavior patterns. So if you've ever caught yourself thinking, I know why I do this, so why do I keep doing it? This episode is for you. And just a reminder, this podcast is for educational purposes only and is not a substitute for therapy. So let's go ahead and get honest. Awareness matters, insight matters, understanding your attachment style, your childhood dynamics, your emotional patterns. Those things are all foundational. But awareness alone does not create change. You can know you have anxious attachment or avoidant attachment. You could recognize that you people please. And you can understand that you have fear of abandonment or other things going on. But still, you might send the text you didn't want to send. You'll double text when you feel anxious. You overextend yourself to keep the peace. You ignore your own needs to avoid conflict. Awareness is the entry point to understanding what we're doing, but it is not the piece of transformation that we need. And this is where so many people get stuck. They think, I've done the work, I understand myself. But insight without action keeps you in the exact same cycle, just with more awareness of what you're doing. And sometimes that's even more frustrating because now you see it happening in real time and you still feel like you can't stop it. Because understanding yourself and showing up differently in real time are 2 completely different skill sets. One is a cognitive practice, whereas the other one is behavioral and often physiological. And if you don't bridge that gap, nothing is going to change. So why do we keep doing the same things even when we know better? First, your nervous system is wired for familiarity, not for health. Your body is not asking, is this good for me? It's asking, is this familiar to me? So even if something is unhealthy, if it's familiar, your body will default to it. That's why awareness alone isn't enough, because when your nervous system is activated, you're not choosing, you're reacting. Second, these patterns were learned and reinforced over time. People-pleasing worked at one point. Avoidance protected you at one point. Reassurance seeking helped you feel safe at one point. These aren't random behaviors. They are adaptive behaviors. They helped you navigate something at some point in your life. So your brain and body learned, this works, let's keep doing it. And now, even if it no longer serves you, you still go back to it. Because it feels known, it feels predictable, it feels safe. And third, change requires discomfort. And most people don't actually avoid change. They avoid the discomfort that comes with it. Because choosing a new response doesn't feel natural at first for anybody. It feels unfamiliar, it feels uncomfortable, it can even feel wrong. Setting a boundary, for example, might make your chest tighten. Not texting back immediately might spike your anxiety. Choosing not to over-explain yourself might feel like you're doing something bad. But that discomfort, that is not a sign you're doing something wrong. It's often a sign you're doing something different and your body is not accustomed to it. And this is exactly where body-based therapy came in our last episode. Because body-based therapy helps you regulate through that discomfort instead of escaping it. Because if you can't stay present in that moment, you will default back to that pattern every single time. No question about it. And now that we have a better understanding of what body-based therapy is, like our somatic practices in the last episode that Chloe and I talked about, this is where I want to bring in skills-based therapy. Awareness or insight-based therapy tells you what's happening. Body-based therapy helps you stay grounded in it. But skills-based therapy tells you what to do next. It focuses on what you actually do differently, because real change is going to happen when all three of these approaches are working together. Insight-based therapy is going to help you understand your patterns and connect your past to your present. Body-based therapy helps you regulate your nervous system so you can stay present instead of reacting. Skills-based therapy is going to help you change your behavior in real time. And this is what is going to bridge that gap that I mentioned earlier between awareness and action, and where this transformation that we need is going to happen. You have to practice doing it better in real time in the exact moments your patterns are showing up. That is the only way to start to change how you're responding. Skills-based therapy is going to give you tools, strategies, language, and real-time responses that you need. So when you're triggered, activated, or uncomfortable, you're not just reacting, you're choosing your response. You're going to pause, check in with yourself, and respond intentionally. And in dating, that can look like not sending that text right away, saying, I need time to think about that instead of overcommitting, setting boundaries without over-explaining, and letting someone be responsible for their own emotions. Skills-based therapy allows you to start making small shifts, but those small shifts over time will begin to change everything for you. Skills-based therapy is also going to answer questions like, what do I say instead? How do I stop this behavior? And how do I set boundaries without feeling guilty? There are a few main approaches that I do want to speak on whenever it comes to skills-based therapy that I think will be helpful for anyone who is listening to this podcast. And I want to go into these with you all during this episode. The first approach that is very well known among practitioners is called cognitive behavioral therapy, or also commonly known as CBT. CBT is a structured and evidence-based therapy that focuses on how your thoughts, feelings, and behaviors are all connected, and how changing one can change the others. So that domino effect. It is built on a simple idea that you're not just reacting to situations, you're reacting to the meaning you assign to them. It looks at three things. So your thoughts, like what you're telling yourself, your feelings that are attached to what's going on, and your behaviors. So what are you doing next? An example of this in dating would be maybe the thought that somebody hasn't texted me back yet. They're losing interest, which then has the accompanying feeling of anxiety and insecurity. Because the thought process and feelings you're experiencing makes you want to engage in the behavior of over-texting or checking your phone constantly. CBT practices help you interrupt the cycle. These practices teach you to identify unhelpful thought patterns, ones that might feel true in the moment, even if they're not true, and help you create effective change. And I want to give examples of some common but unhelpful thought patterns that we can have. These would include mind reading, saying, they're definitely not into me, they don't like me, they think I'm annoying. Catastrophizing is another one. This is going to end badly. I ruin this. All or nothing thinking, which can also be called black and white thinking. If it's not perfect, it's a failure. CBT helps you interrupt these thought processes and reframe how you're thinking. So you're challenging these thought patterns. And you don't have to do this with toxic positivity. You just need to be realistic and grounded in your thinking. Instead of thinking they're ignoring me, maybe shifting your mindset to, I don't have enough information yet. There might be multiple reasons they're not responding right now. You're going to have to change learned behavior that reinforce past patterns, because behavior either will feed your anxiety or it will calm it. So instead of sending 3 follow-up texts, you could wait, engage in another activity, or practice emotional regulation skills. And I do want to remind everyone that it is important to acknowledge your feelings and to not use activities to continuously distract yourself from acknowledging your feelings and practicing regulation skills. Other ways you can incorporate CBT practices daily is keeping thought records. For me and for others, sometimes having the written information can help with the processing of what's going on. You can write out situations, thoughts, alternatives. You can also engage in behavioral activation, which helps you connect and engage in activities that are personally rewarding, even when you don't want to do them. I know that anxiety and depression can be debilitating for some, but whenever you're withdrawing from activities due to depression or anxiety, that can actually cause symptoms to be worse and increase those feelings of sadness and hopelessness. So it's important to go out, socialize, exercise, or pursue hobbies that you enjoy and rekindle your interest in things that bring you joy daily and help you feel like you have a sense of achievement, because you are your own person. You are separate from somebody else inside of a relationship. You're together, but you're also able to do your own activities and have your sense of self. Exposing yourself to situations that may seem unsafe, even when they're not, is also another good CBT practice. And when I'm talking about exposure, I'm not saying that you need to expose yourself to the worst fear you could ever think of. It means gradually facing situations you avoid so your anxiety doesn't continue to run your life. In dating, anxiety that is running your life can sound like, what if they don't like me? What if I get rejected? What if I say the wrong thing? So instead of risking that feeling, you tend to avoid. This can look like not replying, canceling dates, staying in the talking stage forever, and choosing emotionally unavailable people because it feels safer. And you know what to expect. You know they're not going to be there. You know that by not putting yourself out there, you're not risking your heart to be broken. You're not risking that chance that they're not going to be there at some point. You're not risking the rejection. But avoidance will give you short-term relief, but it will continue to reinforce your fear long-term. It'll make you believe that you survived because you didn't do something. But exposure will have the opposite effect and create a positive shift in thinking. You'll begin to realize that you survived even when you did something that was not unsafe, but something that was uncomfortable. That shift is everything. I also do want to clarify that exposure, again, is not just throwing yourself into your worst fears. Not saying go into the ocean and be around a bunch of great white sharks. Don't do that. What I am saying is that you can gradually, intentionally, and repeatably go through the process of exposing yourself to things that might seem a little scary, but aren't unsafe. I want you to think of exposure kind of like a ladder, right? Low exposure or the bottom of the ladder might be making eye contact, sending the first text, or saying you had a good time. The middle of that ladder might be going on a first date, telling somebody what your preferences are, and letting a conversation end naturally and not overfunctioning, trying to maintain it. Because you don't need to do that. If somebody wants to talk, they'll talk to you. Now, something considered high exposure, and this will vary with everybody, what they consider low, medium, or high exposure. But something for me that might be considered high exposure is going on a first date. Something considered high exposure at the top of the ladder could be being emotionally honest, setting a boundary, or saying, I like you without knowing the outcome. And that can be really scary whenever you don't know what to expect. That's where that discomfort comes in. And reminding yourself that even though I don't know what's going to happen, I know I'm going to be okay. A real life example of this exposure piece could be maybe that you feel anxious and you begin to overthink a situation. I know we've all done this in dating and like, what's going on? Are they interested? What happened? I say everybody. I've done this at least, but it is relatable to a lot of people from who I've spoken with. When you're overthinking, you might stop responding, which will result in connection fading. It's going to automatically fade if you're not engaging with that person. So you're actually going into this self-fulfilling prophecy, even if it's unintentional, of if I don't respond, then nobody can hurt me. And instead of engaging in that avoidance and self-fulfilling prophecy, the healthier behavior is you engage in that exposure. You feel anxious, but you respond anyway. There's going to be discomfort with responding, but the mindset that you should begin to have is, I didn't die from that. I can handle this. You are retraining your brain to understand that anxiety doesn't mean there's danger present, and that rejection doesn't need to be devastating, and discomfort isn't something you have to escape from. Even though we don't like it, I get it. I don't like discomfort either. But you are building emotional tolerance, not perfection. The second skill-based therapeutic approach that I want to discuss is called dialectical behavior therapy, or commonly known to therapists as DBT. So we have CBT, now we have DBT. And these are all skills-based therapy approaches. Dialectical behavior therapy is a skills-based therapy that helps you manage intense emotions, navigate relationships, and respond instead of react. It was originally developed to support people who felt emotions very deeply, but it's now widely used for anxiety, trauma, and relationship patterns, which is why we're talking about it. And for anyone wondering what the heck dialectical means, because I had that question too when I started learning more about therapeutic approaches, dialectical means that you can hold two things at once with both being true. For example, I accept myself as I am, and I want to change. You can feel two things at the same time. And most people struggle in dating because they think it has to be one or the other, back into that contrast of thinking. These are some examples. Either I need to be chill or I'm too needy. I need to like them or I need to protect myself from them. I trust them or I need to leave. This is very black and white thinking, which results in spiraling. And for those that aren't familiar with spiraling, that is just where you get into this vicious feedback loop of thoughts. The more negative thinking you have, the more negative thoughts to become, the more anxiety you feel, and the more your body begins to respond. So it's very, very vicious and can be a hard loop to break. But with DBT, like I said, this is where you can have two things you can hold and acknowledge that both are true. Another example is that you can have interest, but also hold space for uncertainty while staying grounded. And there are 4 core areas that DBT is centered around. And these include mindfulness practices, distress tolerance, emotional regulation, and interpersonal effectiveness. So I'm going to go into these 4 core areas with you all. Mindfulness, and I know a lot of people know about mindfulness, but mindfulness helps you focus on staying present instead of spiraling, so engaging in that feedback loop I was talking about. And this means noticing your thoughts without immediately reacting. And it also means observing your emotions instead of becoming them. We can feed into our emotions pretty easily, but to be able to pull back and look at them in an objective way can help us remove those pieces of anxiety. In dating, this can look like noticing you're anxious, but knowing you don't have to act on it. Now, distress tolerance in DBT focuses on getting through intense moments without making things worse. So this is for when our emotions are too high and we're not able to think as clearly. Distress tolerance skills in DBT include using grounding techniques. We've talked about 5-4-3-2-1, which is bringing yourself back to the present space you're in. We've talked about breathing exercises before. Even holding a piece of ice can actually help you with regulation. You can engage in self-soothing practices or engage in distractions in healthy ways, right? We still want to acknowledge our feelings and what's going on, because if we don't ever process them, then we can't work through them. An example of distress tolerance in dating would be, instead of panic texting or shutting down, you're going to pause, regulate, and ride the wave of emotion. Because it's going to be there, the discomfort, the emotion, but gradually increasing your tolerance to what's going on and reminding yourself that you're going to be okay through this process. And these are emotions. You are not unsafe. You are not in danger. You are feeling the emotions, though. And now we're also going to go into emotional regulation in DBT, which focuses on understanding and managing your emotions over time. Again, identifying what you're actually feeling, because it's super important. Reducing emotional vulnerability, not letting your emotions run the show. and increasing emotional stability. So staying grounded in your emotions, even if they're heightened. In dating, this could mean asking yourself, is this anxiety or is this actually a red flag? It's a very important question. I've heard a lot of people use the word red flag. Like, I don't know if that's a red flag. That just might be how they engage. Now, it could be a red flag for you, but understanding what our fears are and whether or not it's anxiety or something to actually be cautious of is important. And then the last core area in DBT is that interpersonal effectiveness. The focus of interpersonal effectiveness is on communicating clearly while respecting yourself and others. This means setting boundaries, asking for what you need, and saying no without feelings of guilt. DBT is going to help you break unhealthy cycles and replace them with healthier ones. You're going to learn specific skills. And if you're doing this in a therapeutic space, which you should if you're going to get more into DBT, practicing them outside of session. If you're only practicing them in session, it's not going to be effective. You're only doing that behavior in one space. And to make effective change, you're going to have to do it outside of that space. That's like if you were doing physical therapy. Whatever exercises they're going to give you in physical therapy, you need to do outside of physical therapy. It's the continuous practice of healthy behaviors that is going to create change for you. And DBT is not about asking yourself why you're a certain way. It's about asking, what can I do differently right now? It is a powerful practice in dating because dating activates everything. We're building a relationship with somebody. We're building connection, and that's really scary. It can be exciting, but it can be scary as well because you don't know what's going to happen. And that's with any relationship that you're building, whether it be a friendship, a relationship at work, and I'm not saying romantic relationship, but just not knowing the other individual and how they're going to respond to things. You're gradually learning about somebody. Dating specifically activates everything like attachment wounds, fear of rejection, and emotional highs and lows. It's going to bring your patterns to the surface in real time, which means that if you want to engage in healthier practices, you're going to have to work through it. DBT is going to give you the tools to navigate that. It's going to help you not overreact when you're triggered, not abandon yourself just to keep someone, because abandoning yourself is not a healthy practice. If someone can't accept you for who they are, let them leave. Or if they can't be there with you through the hard moments, let them leave. You deserve better. DBT is also going to help you stay grounded even when things feel uncertain. Uncertainty still scares me. That's something I have to practice every day, is working through that. So I don't want anybody to feel alone whenever you're having these emotions. I'm in a therapeutic field and I'm aware of what's going on, but I do have to practice staying grounded, not overreacting, and not abandoning myself in these relationships. An example of using DBT skills in real time would be knowing you really like someone while also acknowledging that you don't know where the relationship is going, that uncertainty. And when that uncertainty shows up, instead of overinvesting and getting hurt or shutting down and missing connection, you can stay open and grounded at the same time, not placing so much of a hold on yourself or the other individual, allowing space for whatever's about to unravel. And we talked about holding two things at once earlier in DBT. I kind of want to go over some examples of this. So another example of holding two things at once is feeling anxious while also recognizing that anxiety doesn't automatically mean something is wrong. Anxiety is your own personal reaction, and then what we can do based off how we're feeling is project what our thoughts are or our feelings are onto the situation and the other individual, which isn't fair to them. And it's really not fair to you. You're creating your own thoughts and ideas in your head about what's going on, when in actuality, that might not be it at all. So instead of reacting and thinking something's wrong and over texting or spiraling, you can notice the feeling, come back to the facts of the situation, not just the emotion, and respond intentionally. The same applies to boundaries and connection when we're talking about holding two things at once. Both boundaries and connection matter a lot. I've talked about boundaries before. They're very important. You have to know where you're at and what you are or are not willing to do whenever you're in dating. If you're not at that point where you can say, hey, this is what I need, it might be time to reevaluate if you're ready to date somebody. What are my expectations? What are my boundaries? So when we're talking about boundaries and connection, you can like someone and still need consistency in order to keep investing in that person. If I'm going to invest in somebody, I do have my boundaries and expectations, and that's okay. And I have learned over time that if somebody's not going to stay because I had to set a boundary, then that person is not meant for me. Instead of choosing them over yourself or cutting them off completely, you can communicate clearly what your needs are and stay aligned with your own standards. And again, somebody that is wanting to stay will stay. Somebody that does not want to stay will show you that or tell you that. And that's completely normal in dating. Not every relationship you go into is going to work out. And I think that's a hard truth we all have to face. I've seen many times where we go into dating, even for myself, and I've had to be better about this, where it's like, well, I hope this one works out. And most of the time, it's not going to work out. And that's not necessarily a bad thing. But whenever you're thinking about finding somebody that's compatible, whenever you're thinking about finding somebody that you can spend the rest of your life with, there's a lot of weight to that. So having this expectation that the first person you meet is going to be the one is one that I would be very cautious with. And I'm not saying it can't happen, but the reality is whenever you're dating, going in with that open mind and grounded self is so important because you don't know what's going to happen. I've been on dates where I thought somebody was going to be great and it turned out to be a nightmare. They were not who I thought they were, and we were just not compatible, and that's okay. With that being said, I do want to go back to DBT. This practice isn't easy, and the reason this isn't easy is because your nervous system is wired for certainty and safety, which means it will naturally push you toward extremes you've engaged in before. So maybe that's clinging to make you feel secure or avoiding to protect yourself. And in DBT, going back to holding two things at once, that means you have to stay in that discomfort without trying to escape it. And when you do that, when you actually practice these skills and sit with the discomfort, you're going to start to build emotional tolerance, more secure attachment behaviors, clear communication, and less reactive dating patterns. A practical way to use DBT in real time is by using this phrase. It's a great one to have. But it's, I feel blank and I can still blank. Examples of this might be, I feel anxious and I can give this space. I can make room for my anxiety, but I'm also not going to let it control me. I'm not going to let it be the driver of my emotions. Another example, I feel excited and I'm going to pace myself. And the last example I want to use is I feel unsure and I can ask for clarity. At its core, DBT is about emotional regulation, distress tolerance, and communication. And whenever you think about that, that's everything in relationships. You're not reacting impulsively. You're learning how to sit with the emotion, regulate it, and then respond in a way that aligns with who you want to be. And this is where all of these practices come together. CBT helps you notice and shift your thoughts. DBT helps you regulate your emotions and respond instead of react. Both of these therapeutic approaches ask something of you in real time, which is to do something different. And that brings us to the part that people don't always talk about. Again, doing things differently will feel uncomfortable, wrong, unfamiliar at first. And it'll feel that way if you're used to chaos. Because when you're used to chaos, calm can feel boring. You're not used to it. It's something feels off. If you're used to overgiving, boundaries can feel selfish. You can think they're not going to like me anymore if I tell them this is what I need. I've done that before. I'm not ashamed of it. I've had to redirect that response, but it can feel like you're not giving enough. If you're used to reacting, pausing can feel unnatural. Again, with patterns of my anxious attachment style that I've had to work through, overextending and having to over-explain was my way of reacting. And learning how to pause in moments and maybe give somebody space can feel unnatural, but it's something that I've had to practice. And it didn't happen overnight where I've been able to make these changes. With the discomfort, it doesn't mean you're doing anything wrong. It means that you're doing something different. And that's okay. That's the point of using these daily skills. So if we zoom out on this entire series, insight-based therapy helps you understand why you are the way you are, connecting all the dots like that detective I spoke about in the first episode. And then body-based therapy helps you understand how it shows up in your body. What am I feeling? What are my physical reactions to this? How do I ground myself whenever things are going on? Skills-based therapy, like CBT and DBT, helps you change what you actually do in those moments. And you need all three. Healing isn't just about awareness. It's about choosing differently in the moments that matter. It's about noticing the thought, feeling the emotion, staying present in your body, and still choosing a different response. And I don't expect these changes to happen overnight, right? I told you mine haven't happened overnight. This has been a daily practice. And whenever you're coupled or you're dating, there are those moments where nobody should expect perfection from you whenever you're trying to go through this process, and you shouldn't expect perfection from them. Now, the effort needs to be there, but these skills will be something that you gradually build over time. We're all human. We're not perfect. So gradually incorporating the skill set is the best way to have an effective outcome. Those small moments matter because they gradually build over time. They are what is going to create change for you. I do want to close out this episode by asking a question, and you all can think about it. You can send me a message and let me know what your answer is. But I want you to ask yourself, what are you going to choose to do differently this week, over the next 2 weeks? Also, if this episode resonated with you, I want you to take one thing from this and actually apply it this week. Again, not perfectly, not all at once. Just one moment where you pause, check in, and choose a different response. Doesn't have to be big. It doesn't have to be in perfect shifts, but in small intentional decisions and repeated over time. And please make sure to follow the So Happy Together podcast on Spotify, Apple Podcast, YouTube, or whatever you listen to. And follow along on Instagram and TikTok for more therapy-informed tools you can actually use in your relationships. And if you know someone who's aware of their patterns but feels stuck in them, send this episode to them. Because sometimes hearing it differently is what's going to help it finally click. I will see you all next week.